Good afternoon. 2 years ago, I traveled to Malawi, where I met these 3 little girls outside St. Gabriel's Hospital. These little girls are so beautiful and so funny. But when I think about the way that our world has forgotten about little girls like these, it makes me very sad and very angry. Every year, 9 million children under the age of 5 die. 9 million. It's a big number. To put it in perspective, it's the equivalent of every family in New York, California, and Texas losing a child. Every family. My family, your family, every family in the city of Houston, every family in the state of Texas. Imagine the response the world would have if this tragedy took place in the United States. But 98% of the children who die live in developing countries, and we don't even notice. When I think about this picture, though, it also gives me hope, because we can find ways to become part of the solution to what feels like an overwhelming challenge. Remember when you were a college student? You thought you could change the world? Maria and I are professors at Rice, and we have the opportunity every day to work with students who see a future with seemingly unlimited possibility. 4 years ago, we had an idea. We thought we could harness the energy and the idealism of our students to solve the challenges of global health. There's a Haitian saying, "You do not learn to swim in the library, you learn to swim in the river." We thought if we want our students to change the world, we have to change the way that we teach. We sought the advice of doctors and nurses who are taking care of patients in the poorest part of the world. Some became our partners, and together we turned the challenges that they face in delivering care into problems that teams of our students could solve. With funding from the Howard Hughes Medical Institute, we now teach students to design health technologies to work in clinics that may lack electricity, that may lack running water, and that may not have access to disposable supplies. And we're fully committed to making sure that these affordable technologies meet all the appropriate safety and regulatory standards. Can these students change the world? Well, they already are. This is Jocelyn Brown. Jocelyn was a bioengineering student at Rice, and she worked with a team of students to design a backpack to allow eye care in poor parts of the world. In 2009, Jocelyn traveled to Haiti, where she worked in a remote part of the country with a local physician to evaluate the pack. And Jocelyn blogged about her experience, and I want to share something that she wrote about her time there. She said, when Dr. Lucien asked one woman how she was doing since her surgery, she replied, "Map danser," which means I'm dancing in Creole. Jocelyn continued, "I cannot imagine how it must feel to have sight restored after years of blindness. While working on my project during the school year, I learned that in places like Haiti, where eye care is not readily available, most people accept their blindness as a permanent condition and learn to live with it." Dr. Lucien's work is a testament to the fact that Haitians should not and do not have to learn to live with treatable blindness. Effective medical care begins with good diagnostics. Think about the last time you went to the doctor and your doctor needed to run some lab tests. She probably filled out a form like this where she could check one of hundreds of boxes for whatever tests you needed to have. You took your slip of paper down the hall to the lab where a lab tech in a clean white coat took your blood, and that tube of blood was whisked off to a lab that's filled with state-of-the-art equipment. Well, for 1/3 of the world living in extreme poverty, the lab looks like this. Medical brigades, like this one staffed by Project Medishare in Haiti, travel to rural areas when the roads are passable. They treat patients while their supplies last. Patients often wait for hours to be seen in outdoor clinics. Often, diagnosis is based on clinical symptoms alone, and it's hard to know who should be referred for an expensive trip to the city for more intensive care. We worked with a program at Baylor called the Shoulder to Shoulder program. Shoulder to Shoulder provides medical brigade care in a rural area of Honduras lacking electrical power and running water. The Shoulder to Shoulder physicians wanted to be able to bring a diagnostic backpack with them that would allow them to provide laboratory services. A team of bioengineering students developed this lab in a backpack. It's powered by a laptop battery, which can be recharged with a solar panel, and it contains all of the equipment that's necessary to do a physical exam and basic lab services, including a stethoscope, a glucometer, an otoscope, an ophthalmoscope, a pulse oximeter, a centrifuge, and a microscope to diagnose TB and malaria. Rice sociology major Kelly O'Connor took that backpack to Haiti, where she worked with those medical outreach teams to transform the diagnostic capabilities that they were able to offer. Now, when Kelly was in Haiti, she found that the electrical centrifuge that they used to determine whether patients were anemic sometimes broke. This is the heaviest piece of equipment in the pack, and at $300, it's also one of the most expensive pieces of equipment in the pack. When Kelly returned to Rice, she worked with a team of students to develop a simple alternative. Kelly's team had the brilliant idea to start with a salad spinner, which they bought at Target for $30. Using only hot glue, an empty yogurt container, and plastic combs, they transformed the salad spinner into a mechanical centrifuge that allowed them to be able to accurately measure whether or not patients are anemic. State-of-the-art laboratories use a technology called fluorescence microscopy to diagnose whether patients have malaria or TB with maximum sensitivity. The challenge is that fluorescence microscopes are too expensive and too fragile to survive a trip in this pack. Rice bioengineering student Andy Miller designed a low-cost, durable fluorescence microscope which could make the trip. This microscope can be manufactured for $220. Andy tested it at Methodist Hospital and showed that it was able to perform as effectively as a clinical grade microscope that cost $40,000. Now, what happens if you have the microscope but nobody with the expertise to look through the microscope and provide a diagnosis? It's a very common situation in the developing world. Well, Andy designed a shelf which we can place right on top of the microscope, allowing me to use the camera in my iPhone to actually capture a digital image of the slide which is on the stage, and I can then email that image to a physician anywhere in the world to provide interpretation. And in fact, our students are designing iPhone apps that can be used to automate the interpretation of those images. We've worked with the Baylor International Pediatric AIDS Initiative and Medical Bridges to send packs out by bicycle to rural areas in sub-Saharan Africa. One of our collaborators wrote to say, "Now we will have a little hospital when we go to the villages." We've sent packs on ox-driven carts over what our collaborators called the God-forsaken roads of Myanmar. And we're now working with the Futuro Foundation and the Ministry of Health in Ecuador to do a countrywide scale-up of these student-designed technologies. These 24 packs are now being used across the country of Ecuador, where over the next year, they will provide care for an estimated 120,000 patients. What is my dream for the future? I hope to work with our partners in Malawi to equip all of the rural health clinics surrounding St. Gabriel's Hospital with these diagnostic technologies. I hope that the next time one of these little girls needs to visit the doctor, that their disease can be diagnosed and treated quickly and efficiently because these technologies are available. My dream is that these little girls will not become a statistic, but they will grow up to become the doctors and the engineers who run the lab of the future.
The newborn nursery is the place in the hospital where the right technology can make a tremendous difference in the lives of children. 25% of childhood death and serious illness occurs during the first week of life. What do babies need? Babies need to be kept warm. They need to be hydrated. They need some support for breathing if their lungs are not fully developed. If we can take care of those specific problems, we can greatly reduce the incidence of death early on in a child's life. If a child were born in Houston and needs intensive care, they would find themselves in an environment like this, where there's an abundance of technology that can assist in their care. If that same child is born in a low-resource setting, you might have what you see here: a very sick child, a very caring clinician, and very little technology to assist in their care. This is Dr. Liz Molyneux. She's a pediatrician in Blantyre, Malawi. She has worked there since the 1970s. The first time Rebecca and I met Liz, we were in absolute awe of her resourcefulness and how she was able to effectively run a neonatal intensive care unit in such a low resource setting. She was an example that we wanted to show our students and inspire our students. In the neonatal nursery at the hospital where she works, there were a number of Western-style incubators. Most of them were broken. They had been donated to her clinic, and they arrived and they worked for a while, and then they broke. There were no parts to make the repairs. There were no technicians who understood how to make these repairs. So Dr. Molyneux found a design for an incubator that could be made locally out of plywood and light bulbs. The way that this incubator works is that it has two chambers, and in the lower chamber there are light bulbs that the nurses can turn on, and the upper chamber warms for the baby. When it gets warm enough, the nurses can turn it off. We asked Dr. Molyneux if we could offer the task of improving the efficiency of this incubator to our students, and she readily agreed. What you see here is an improved incubator that is optimized, and it contains some control systems to automatically control the temperature, but they're made with temperature-sensitive switches that are extremely durable. Again, this is made of plywood and light bulbs and very simple electronics, so it can be fixed in the field. At Dr. Molyneux's hospital, when we visited her, when she had a baby with neonatal jaundice, she could treat them with phototherapy lights, but she could only treat one baby at a time. The systems, the phototherapy systems that are used to treat neonatal jaundice, cost between $2,000 and $6,000 each. She asked us if our students could design a product that would be able to work for more babies and be less expensive and not require $300 light bulbs every time they broke. This is an extremely difficult situation in a low resource setting. One of our students took up the challenge. As a freshman, UNQ worked tirelessly over a particular summer to improve the design that was worked on by a group of senior bioengineering students. She prepared 5 prototypes for us to take to Dr. Molyneux. These devices cost $50 each. We delivered these devices to Dr. Molyneux, and over the course of the following year, we received feedback. What worked? What didn't work? What needed to be improved with the design? The following summer, Ewan made these improvements and was able to deliver phototherapy lights herself. Ewan wrote about this experience. There were the Billy lights propped on top of the wooden incubators. I felt honored that the lights I helped make were being used. It was surreal to actually see babies under the Billy lights that I made last summer. I thought about it, dreamed about it, but I couldn't believe I was actually seeing it in a hospital setting. This is the fire that is lit in students when we can provide them and encourage them to meet challenges in global health. This summer, Ewan is back in Malawi and will be able to work with Dr. Molyneux for the month of July. While Ewan was there that year, Dr. Molyneux was able to tell her about another challenge that could save lives. She requested a very simple method to help babies breathe when their lungs were underdeveloped. So a team of engineering students worked in the Oshman Engineering Design Kitchen at Rice to meet this challenge. They were mentored by Dr. Heather Machen at Texas Children's Hospital, and they designed just such a device. It is designed to work for babies who are able to breathe on their own, but need a little bit of additional support to keep their lungs inflated so the oxygen can reach the organs that they need in their bodies. This CPAP system, which costs less than $150 to manufacture, provides a very important option for giving respiratory assistance to babies. This system still must be fully evaluated for a quality improvement in developing world settings, but it promises to be a huge advance in newborn care in these environments. A neonatal nursery of the future for a district hospital that might serve 300,000 people, an entire neonatal nursery outfitted with technologies like these and a few others could be set up for about $5,000. This is less than the cost of one Western-style ventilator. My dream is to go to a developing world hospital someday that I have never visited and to enter the neonatal nursery and find some of these technologies working to save the lives of babies. Even better would be if one of our students was the physician or the bioengineer that set up the technologies and trained local people to repair them, maintain them, and make them sustainable in this environment. When our students put their own ideas into action, they become the leaders of the 21st century. Leaders who recognize that losing 9 million children each year matters to all citizens of the world. One of our students, as she was leaving Lesotho after an 8-week internship, wrote the following: I have seen the struggling face of a baby who died of a simple case of diarrheal infection, and the face of her mother who thought the child was on her way to improvement. I have seen the determined faces of the medical team that went to great lengths to get a child to a South African hospital just to put the baby on a life-saving ventilator, a simple tool that they lacked in Lesotho. I will leave with a more inspired opinion of what I can do as an individual, what the limit of that is, and what the potential of that is. The challenges of global health are enormous. But Christina and her classmates believe that they can be a part of the solution. So they jump into the river and they become part of the solution. They show us the power that we all have to become a part of the solution. Thank you.